In a recent exclusive interview with Nightly News, Dr. Cadaver transplant surgeon and head of transplant and vascular surgery department at the Georgetown Public Hospital, revealed that Guyana currently has over some 200 patients accessing dialysis treatment, of which 80% are eligible for a kidney transplant but do not have donors.
The thing is, the setback to that, not many, less than 20% have donor. So we have approximately around 30 patients who are currently being worked up with potential donor to have living donor transplant.
Prasad added that the Transplant and Vascular Surgery Department is currently working with the Chief Executive Officer, CEO of Gphc, Robbie Rambaran, and Chairman of Gphc's Board of Directors and Advisor to the Ministry of Health, Dr. Leslie Ramsamy, for the legislation of human tissue transplant in Guyana and the establishment of a tissue and cadaver transplant laboratory.
If we can have the capability, we can establish the tissue typing lab here, we can then go ahead with cadaver transplant, where we can use kidney from patients who are brain dead and transplant patients who are on dialysis.
The transplant surgeon further underscored that the establishment of such an important and much needed lab will maintain and improve the local health sector while providing a variety of benefits to persons requiring organ transplants and relieve the burden on families and those patients who require dialysis or kidney transplants.
So one brain dead patient will help to take off 2 patients from dialysis and make them and reintroduce them into society where they could work and live a healthy life.
Prasad also noted that there has been a high demand for organ transplantation locally, and once the draft for the legislation is approved and the requisite requirements are met, a cadaver transplant lab could be introduced in Guyana by the end of this year. The legislation would allow the family of brain dead or deceased individuals to donate the organs of the individual once they have been legally determined brain dead. It would also allow persons to register if they want to donate their organs when they die. Importantly, he advised persons with kidney failure to get vaccinated since they are at an increased risk of experiencing severe symptoms of COVID-19 and dying if infected. Cadaver transplant is a process of surgically transferring a donated organ from a deceased person into a patient with end-stage organ failure. Reporting for the AGP Nightly News, Joel Vogt.